Turning now to the pandemic. After weeks of dropping case numbers, it may appear the COVID-19 crisis is beginning to ease, but there continue to be warnings Canada is not in the clear. More cases of the highly contagious new variants are being detected every day. New Brunswick and Saskatchewan confirmed their first cases of the UK variant today. At least 148 variant cases have been detected across the country. It's likely many more are undetected. The concern is they could spread much faster than vaccines are rolling out. Today, the Prime Minister announced a plan with vaccine maker Novavax to produce a COVID-19 vaccine here in Canada.
This is a major step forward to get vaccines made in Canada for Canadians.
The Novavax vaccine, though, has not been approved for use in Canada yet, and building the production facility in Montreal will take months. Abigail Bimman has the details tonight on what's promised and the challenge of delivering on it.
Tens of millions of Novavax COVID-19 doses will be made right here at home.
There are asterisks attached to the Prime Minister's announcement. The Novavax vaccine needs to be approved by Health Canada. The National Research Council's new plant needs to be built.
The production facility should be completed this summer.
But that doesn't mean vaccines will flow right away, the industry minister clarified.
So we expect by the end of the year to be in a position to be producing vaccines. And we're talking around 2 million doses a month.
Neither Novavax nor the NRC responded to an interview request, but VIDO at the University of Saskatchewan, the Vaccine and Infectious Disease Organization, painted a similar picture. The Prime Minister announced it can produce up to 40 million doses a year once its new facility is built.
The schedule is for construction to be completed by the end of October.
It doesn't expect to be making vaccines until about the middle of 2022.
These are very complex facilities, and so the regulator will want to come in and make sure that what we have built is to the standard and meets all the necessary requirements.
Ottawa also announced a further $25.1 million for Precision Nanosystems for its new vaccine facility, slated to be finished by March 2023. The company says it can produce up to 240 million doses of its new self-amplifying RNA vaccine, if approved.
RNA vaccines, as a general class, will be the technology that allows for changes to chase after any mutations of the pathogen of the virus. So it's a very flexible technology.
We also have to prepare for future variants, and the investment in those technologies and the manufacturing capacity to produce those technologies, I think, is still going to be very important in the future.
Ottawa has a deal with Novavax to buy 52 million doses with an option for 24 million more. Precision Nanosystems and VIDO are both working on Canadian vaccines of their own. VIDO in phase 1 of clinical trials in Halifax. Precision expects to start trials this summer. And while the Prime Minister is committed to getting all Canadians a vaccine by September, none of those will be made in Canada. Abigail Bimman, Global News, Ottawa.
The pandemic has exposed how little vaccine production there is in Canada. Decades ago, Canada's vaccine industry, though, was robust. That started to change in the 1980s when, according to the Canadian press, a number of companies, including AstraZeneca and Johnson & Johnson, shut down their Canadian operations. Today, 2 companies manufacture vaccines here. Both are foreign-owned. French company Sanofi produces vaccines for diseases such as whooping cough in Toronto. And British company GlaxoSmithKline produces influenza vaccines in Quebec. One of the vaccines approved for use in Canada, the Pfizer-BioNTech vaccine, requires special syringes to extract every dose possible from each vial. The federal government says it has ordered 64 million of what are called low dead space syringes. They maximize the extraction of doses from each vial. Pfizer-BioNTech is pushing Health Canada to stretch the number of doses in each vial from 5 to 6. The first shipment of 1 million of the special syringes is expected this week.